Unsatisfied with earlobes after otoplasty. Any suggestions? Hello, I've done otoplasty about 7 months ago. I have an improvement, but my earlobes are still the same, like before surgery. Is it possible to make surgery just to improve the earlobes? Is there a chance a surgery of earlobes could spoil the result? Thanks in advance.
Thank you for your question. You are 7 months out since the procedure of undergoing an otoplasty, and you state that you're satisfied with your result, but you're concerned that the earlobes remain unchanged since prior the surgery. And so you want to know, is it possible to make a correction without affecting the overall outcome of the operation? Well, I can certainly give you some guidance with this procedure and how I would handle it in my practice. I'm a board-certified cosmetic surgeon and fellowship-trained oculofacial plastic and reconstructive surgeon. I've been in practice in Manhattan and Long Island for over 20 years. Otoplasty is something that we do in our practice, as well as other ear-related surgeries such as split earlobe repair and repair of enlarged holes in the earlobes. So it's certainly something that comes to mind when I evaluate a patient who's considering otoplasty. To understand the process of otoplasty, basically, and this is probably was already gone over with your surgeon, but essentially I divide the ear into three segments, an upper, middle, and lower. And the upper segment is basically about restoring something called an antihelical fold and to create a shape. And the middle segment is called the conchal bowl. And typically in my practice, I actually remove cartilage and I place the cartilage closer to the skull base or to the, I should say, to the skull, and place it in a way to move to more predictably position the middle part of the ear. Now, sometimes the earlobe can look good during surgery, but after healing resolves, the earlobe can still look like it's sticking out a little bit. And if that's the case, it is possible to actually do a correction where the earlobe is shifted inward and ultimately gives you more of a desired result. A lot of times the challenge is really is to see what is aesthetically important to you. I can tell you that if you looked around, a lot of people have the same shape of the earlobe where it sticks out a little bit and they're not bothered by it. But I find people who have prominent ears are very analytic about their concerns, and so in terms of any type of enhancement procedure, I think you're dealing with something that's relatively straightforward. It basically involves removal of some skin, maybe a little bit of fatty tissue, and suturing, and can be probably done under local anesthesia. So I recommend you speak to your doctor who performed your surgery and ask about this option, and the doctor will actually will perform a physical examination and see how much the earlobe will go in and discuss with you the possibilities in terms of the outcome. And also understand that it is difficult to make someone 100% symmetric. However, it is, going back to your concern about it affecting the overall surgery, I think it's unlikely to be problematic in that way. So I hope that was helpful. I wish you the best of luck. And thank you for your question.